Good morning. Let me extend a personal welcome to all those who are interested in attending this half-day symposium on Parkinson's disease. Parkinson's is a very debilitating and crippling disorder, particularly related to movement. It's considered as a movement disorder. It affects the life of person who suffers from the disease. Also, close family members who try to provide support to the individual, the patient. In my case, so first of all, let me introduce briefly about myself. I'm a retired professor of genetics from the Institute of Science, and I was diagnosed with Parkinson's disease about 15 years ago, 2009 to be sure. Okay, in the month of March, actually, quite late March. If I remember, 28th was the day. March 28th was the day that I had gone to the hospital to get the confirmation. So, from that point, at the time of the diagnosis, the symptoms are very, very minor, hardly anything at all. People can see me and then don't think that I have any serious disorder at all. But as time progressed, it's a progressive disorder and relates to the loss of cells in the brain in a region called substantia nigra, which makes a neurotransmitter called dopamine, which is necessary for functioning of the neuromuscular junctions. Wherever the neurons and muscles meet, and at the point, it's the neurotransmitter. And dopamine levels drop means all the movements become extremely slow and rigid, and some cases it can lead to tremors, in some other cases rigidity. Two types of issues. So in my case, it's more of rigidity dominant, not so much tremor dominant. So you won't see my hands trembling as in the case of several other people that you may have noticed. But in my case, not so. So in my case, it's rigidity. So as a result, when the dopamine levels dip, then my movement becomes completely slowed down, totally slowed down, and so much so that, in fact, let me just retrace something. So for a long time, the symptoms were reasonably under control. I could even drive my vehicle, even though I would prefer to walk on a sunny day to the institute. And but the thing is, after some time, the symptoms began more and more severe. And at this point of time, when I consulted my neurologist, he said almost all the cells in the brain are dead, all the brain cells making dopamine are dead, and therefore I have no recourse to any other medication other than externally added dopamine. But the thing is, dopamine cannot be treated. Cannot be injected or anything because it cannot cross the blood-brain barrier. That's a major limitation. So the only medication that I have is Syndopa. This is medication. This is tablets. So I have to pop one every 3 hours. My doctor said do not take more than 6 tablets per day because it can induce hallucination and other side effects. And the other major side effect you can see is I can't sit and talk to you because of what are called dyskinesia. Dyskinesia is non-intended targets are triggered by dopamine in the peripheral system. It goes in and then gets absorbed, and dopamine in the brain goes to other receptors that are not necessarily involved in movement, and as a result, total unwanted movements are there, unwanted aspects are there. So that's why I can't sit and talk to you properly. I have to keep on fidgety. I'm very, very fidgety. What? People may ask what this guy is doing. Why is he so fidgety in this issue? Okay, so now the thing is, as the progression worsens, what happens is you can now clearly distinguish two types. So you need to have dopamine, externally added L-dopa, that is to be taken, medication. And if you don't take the medication, you go downhill. Really, you can't move. So it's called bradykinesia, so total lack of movement. And as a result of the lack of movement, and then it's not just lack of movement, John. So you feel terrible also. It's a very difficult to describe the situation. In fact, I have many postings. One of the postings I have said, it almost feels like I'm attacked by the Dementors. This is Harry Potter books. I don't know, J.K. Rowling's novels, you may be familiar. in that she described a situation where you're attacked by dementors. They suck out all happy thoughts from you. So fighting them, you need really something called Patronus charm, which is a lot of light produced, light person, and you have to come up with all the kinds of wonderful friendship, love affairs, love that you have for other people, your friends, love for your friends, all that is brought up. Then only you can repel this dementor. So I almost feel like that every day when the level goes up. It's very difficult to describe. Even caregivers many times don't understand. They get, oh, what is this guy doing? So where's keep on saying that, oh, I feel low, I feel low, I feel low. Because dopamine, in addition to being a neurotransmitter necessary for movements, also a neurotransmitter that makes you happy. When you hear a nice piece of music, like Beethoven's Ninth Symphony or beautiful music or Albudi's Tilanas, anything like that, then the joy that you experience comes from the fact that you have dopamine secreted in the brain. So it's called a pleasure hormone. So when that reduces, then you have serious case of clinical depression. So people go into depression, serious depression. So my doctor has actually advised me, in addition to L-Dopa, asked me to take some medication called Nexitol, something like that. Nexito, yes. It's a mood elevator, so it increases the natural secretion of all other hormones necessary for keeping your mood. An important aspect that I want to present today has to do with a treatment, a therapy for Parkinson's for people who are somewhat late into the onset of the disease. This is called an invasive procedure called Deep Brain Stimulation, DBS for short. It involves a surgical procedure where it's like implanting a brain pacemaker in the body of the individual. For that, it requires the person is operated with minimum penetration. So that, in my own case, first they had to make an MRI scan of my brain or a Google map, so that the doctor, neurologist, and the people involved in selling you the product of to be implanted, they decide on the exact location, and this is done by taking MRI one day before the surgery. There's no such substantial changes in the position, and it involves, they had to anesthetize the patient so that because of the dyskinesia, a lot of movements are there. They don't want any movements in the exact determination of the location. Once that is determined, then they had to cast the next day. I had to clear my head, completely torn shirt hair, and they put a sort of a crown. I call it crown because it's a steel frame and that's clamped there to my head. And then the surgeon, after local anesthesia, he puts 2 holes, the place where the bump is located. So drilled with, of course, local anesthetic, so you don't feel much pain at all. But it's kind of weird having to listen to the sound of the drill going, "Mee," and then there's no pain at all. But then you have to be get conscious, because then they insert the electrode and the positioning is very critical. So the neural keeps on asking me questions. Based on the answer, the fastness of the answer, the accuracy of the answer, they determine whether the position is correct. And then the wires are taken up and subcutaneously, one from the right side and one from the left, 2 electrodes are implanted. Each electrode has 2 prongs, anterior and posterior. So there are 4 parameters in general to be considered in this case. Left electrode, right electrode, anterior, posterior, and then the wires are drawn from left and right and come together, and they implanted under the collarbone, the chest, left side of the chest. And then Once the power is turned on, it keeps constantly supplying pulses, electrical pulses to the brain continuously. Throughout the rest of your life, you need to keep that. And how does it work? This works by aiding in a parallel pathway to the dopamine. So you still have to have dopamine, and the dopamine levels have to be reduced considerably because supposed to work with very much less dopamine. The idea is that dopamine also stimulates, as I said, so many other neurons. So all that has to be brought. So the DBS voltage that you supply is supposed to block those negative impact, negative pathways in some way. Thus help the patient to regain a reasonably normal life. But in my case, to my surprise, shock and surprise, I still need to use very high levels of dopamine, almost as much as sometimes even more, 6 to 7 tablets maximum per day. So when I discuss this with my friends in the PD group, they say, "What the hell, man? Something wrong seriously, you have to consider what's going on." According to them, one possible solution to this is that the voltage is not simply voltage and current. The pulsing, the frequency of the pulsing, so many parameters can be changed. And at present, there's no knowledge, very little knowledge to the doctors as to how this works. So everything's empirical. So they trial and error method. Oh, let's try this. Increase voltage 0.1 millivolt and then decrease it by 1 and so on. So my request is made to all demand through our doctor to the companies that make these manufacture these devices to come up with practical solution to the problem so the patient can get maximum benefit, because I paid a lot of money for this procedure but I've not derived maximum benefit as it was promised to me. When I consult the neurologist, the neurosurgeons are very gung-ho about it. He said they may make wrong statement because for them it's a corporate structure and they need to get so many patients to the, and there's a pre-evaluation of that long procedure. You have to be sensitive. It's only motor neuron deficiency that can be corrected. No other thing can be corrected. In the case of Parkinson's, and also it has to be dopamine sensitive. Not dopamine. There are many dopamine insensitive sort of Parkinson's. So whole spectrum of disorder. This work only with limited cases. In my case, after all evaluation, I said yes, you are a good candidate, and apparently I answered all the questions very rapidly. And the neurologist posed them, and they were happy at that time. But I must say that I'm still not very happy. But I'm still have to take a large amount of medication. Medication on-off times are terrible. Off times are terrible. As I mentioned earlier, in off time I go through sort of every day I go through in a right away, and I had to know articles that I go through whole audio Punrabi Janam, Punrabi Maranam, Punrabi Jatane Janisha, like that. Every time my medicine goes off, I'm dying, almost like 90-year-old man, 100-year-old man. And when I take the medicine within half an hour, I regain my childhood, go through the whole cycles 5-6 times a day. That's no fun, I must say. And the doses are enormous. And the high doses also lead to dyskinesia that you see. So I would like to plead with all the doctors to help us out by putting pressure on the manufacturers of the device so they can.
We really appreciate Professor Mahadevan for sharing his experience with us. Uh, Moving on, I'd like to welcome